Hello, I am Katerina Georgieva. Thank you so much for joining us. CBC Windsor is inside SafePoint, just hours before the doors open to the community. This is the city's very first supervised drug consumption site. It's a place where people can come to use in a controlled setting, and the hope is that this can help reduce overdoses in our community and help save lives. For more, we're going to bring in CBC's Jennifer LaGrassa. Jen, the doors officially open tomorrow morning, and this has been years and years in the making. But we also know that it's been a very contentious issue. There's been a lot of debate around this. But it's ultimately about the people who have been impacted by this city's ongoing drug epidemic. And you've talked to some of these individuals, so tell us what you've been hearing.
Yeah, so everyone tells me that unfortunately there's no easy solution to this, but any sort of resources that can be used to save lives are welcome.
Jail and even death, I can't say didn't scare me, but it definitely didn't stop me.
Angus is 6 months sober after more than 20 years of using substances, specifically meth and opioids. He's asked us not to use his name or face because he worries about finding a job or a home. In his early teens, drugs were fun, but it soon turned into an unbreakable addiction. In the last 6 years, he says he repeatedly overdosed.
I've been very lucky. I can't count how many times I've been basically dead.
While he's still here today, many people he knows aren't. They are who we talk about when we talk about Windsor's opioid crisis. In the time that it's taken Windsor to open a drug consumption and treatment site, the crisis has escalated, with nearly triple the number of people now dying from opioids. In 2016, when safe injection sites were being talked about, the health unit recorded 37 deaths. Last year, 102 people died. 8 of those are still unconfirmed. Data from recent years tells us that it's men between the ages of 25 and 64 who are dying, and the majority of those deaths are happening inside a private home. In the last few years, during COVID-19, the drug crisis worsened.
It continues to be incredibly heartbreaking and frustrating as a service provider. Having the opportunity myself to personally have conversations with folks that are living with substance use and addiction.
It was around the start of the pandemic that Greg's addiction began. A fentanyl prescription to manage pain from surgery led to him abusing the drug. He lost his business and relationships. Greg also didn't want his name or face used to protect future job opportunities.
And it can happen to anybody. Childhood trauma or just bad medication, or not proper guidance, or, a lot of people have a lot of demons they need to escape with drugs, but it can happen for different reasons with everybody.
He's now 7 months sober and has been helping others in their recovery.
People who have used substances tell me that they hope SafePoint can save lives. Greg says that having a place where they can get clean equipment or use substances and not have to worry about an overdose would be a huge help. But both Greg and Angus worry about how convenient it is. They say that a mobile site to meet people where they're at or a spot that has overnight hours would be best. They also say that there needs to be a guarantee for treatment. So when people go there asking for help, they can get that right away. They say that people won't stay on wait lists.
As for those deciding whether to get into recovery, I'll leave you with advice from Angus.
The pain of staying the same has to push you past the fear of change, right? And that's what recovery, the first step of recovery to me is.
Jennifer LaGrassa, CBC News, Windsor.
Over the last week, we've been able to take some time in this space here at SafePoint. So here's a little bit of a breakdown of what it looks like for those of you at home.
This is a look at the floor plan from up above, and this is where you enter from the outside. This here is the main room. Once you're in and have gone through intake, there are 4 booths where people can use drugs. But beyond that, there's also a space where people can chat with workers and access social supports. There's also a clinical space if they don't feel good after consuming and if they might need medical attention. The site is also fully stocked with supplies, clean needles, and of course, naloxone, a drug that reverses the effects of overdoses and can save lives.
It's taken a long time to finally get SafePoint to this point. So let's take a look back and connect the dots at how we got here. SafePoint is finally opening up in Windsor. This is the city's very first supervised drug consumption site. And this moment has been many years in the making, all while the community has been dealing with a growing drug epidemic. So why has it taken so long? Well, there's been red tape and community pushback. So let's go back to the start, 7 years ago, to be exact. That's when Positive Pathways, then known as AIDS Committee of Windsor, first started to get the ball rolling to try and get an overdose prevention site opened up. By 2017, the health unit started considering the idea. The medical officer of health at the time saying, "We've seen in our community that there are a significant number of people who are dying as a result of drug overdoses." They started doing community consultations the following year, but all the while, pushback from local leaders. Former Windsor Police Chief Al Frederick said the service would not support a site. He said, "We need to fully understand the spin-off types of offenses that may occur in communities where these facilities are located." Mayor Drew Dilkins also against a site. Doug Ford, just before becoming premier, also took a stance. He said during an event in April 2018, "I ask anyone out there, if your son, daughter, or loved one ever had an addiction, would you want them to go in a little area and do more drugs? I'm dead against that." Meanwhile, Positive Pathways had submitted an application together with the Windsor Essex Community Health Centre, but that fell through when power shifted at Queen's Park from Liberal to Conservative. Shortly after that election, all applications ended up in limbo. In the meantime, as more people in the community continued to overdose, some started to take matters into their own hands. One group opened an illegal site in Windsor after a 17-year-old died of an apparent drug overdose. The mayor refused to answer questions about it.
There is an unsanctioned overdose site that has been popping up throughout the community. What's your reaction to that?
I'm not even talk about that.
Okay.
That's not even worth it.
That same year, the health unit started working on its own application for a site, but then the pandemic hit, delaying just about everything. By 2022, finally, the location was solidified. It got the green light from City Council, mind you, by a slim margin, but it paved the way for the health unit to finally submit an application to the federal government and to the province. The health unit started working on the building to get it ready for an eventual opening. But then earlier this year, more controversy. There was more debate over funding, over the location that nearly derailed the project once again, but that was put to rest with the health unit agreeing to look for a new location down the road. Then came Health Canada's approval of the site earlier this month, finally giving it that green light for those doors to open. Many breathing a sigh of relief that all of that work finally came to fruition. Though there is one sticking point that remains: money to operate the site from the province. The health unit says that there's no indication of a timeline, but that talks do continue. However, without a commitment, it's city taxpayers who are covering the costs. For more on what this means for the community now, I'm joined by Patrick Kolowitz, the Director of Mental Health and Addictions with Hotel Dieu Grace. Hotel Dieu is the operational lead for SafePoint. And I'm also joined by Leslie Laframboise. Leslie does outreach work in the community solo. She goes out 2 to 3 times a week, connecting with people who are homeless, people who use, providing them with food and with clothes, and sometimes helping them find a place to stay as well. So big thanks to both of you for sitting down and chatting with me. Leslie, I do want to start with you. Given the work that you do, I've heard from you that you're concerned about whether people are actually going to make use of this space. Can you tell me a little bit about your concerns around that?
I've talked to some people, and they will use it for the clean needles. They don't know whether they'll come here and use. Addicts, sometimes might be paranoid, don't like to be around a bunch of people that they don't trust. So, Patrick gave me a good little tour through here. Maybe once they feel comfortable, they will come and use it. But from what I'm hearing from a lot of, they probably won't use it. When they pick up their drug, wherever they are, they're going to use it right where they are. They're not sometimes thinking about a clean needle or a safe place to use. They're just interested in getting high.
I wonder what your response is to that.
Yeah, and I think, Leslie and I had some conversation before we aired today, and I think, it is exactly what she alluded to, that it takes time to build relationships with individuals, especially for an area or a group of individuals that are accessing a CTS like SafePoint, it's a stigmatized area of health, mental health and addictions, in particular addictions. So until we establish the respect and the trust with the community and the individuals who potentially could use the site, we do anticipate the volumes be low or lower than what potentially the need is, which is a great opportunity for us to iron out all of our process, given that this is all new, it's new staff, it's a new team, and it's new people and new processes. So I hope that it's a good scenario to kind of bridge us into where we want to head, which is, you know, enabling the access for people who are in need of the service.
And how are you going to do that outreach to actually reach individuals who maybe are hesitant?
So we've already started that through all the public health consultation in collaboration with the health unit to kind of bring us up to this point in the journey to get people comfortable with a site where people can use and supervise. We know that the federal and the provincial legislation exists that allows us to do it. It's newer for us as a community. So we need to continue with the messaging and the anti-stigma campaigns and messaging to the public that addiction is not a choice. It's not a preference. It's a disease, and it's worthy, just like every other disease that we have in the medical community, that needs to be treated, and we need to have the resources and the availability of service that we can do that and provide that for individuals.
This is just one piece of the puzzle to deal with the ongoing drug epidemic, and I'm wondering, Leslie, what you think is needed next to further support people.
Well, I'd like to see a homeless hub where a lot of services are right there for them available, you know, like a bigger mission, like, you know, some mental health there, you know, a drug addiction program, which they do now have. The mission has the Phoenix program, and I'm seeing more people using it these days, which is really good, you know.
Patrick, let me give you a chance to jump in here as well. What are the next steps for Hotel Jude to try and help people?
Right. So we know that the CTS or SafePoint is one piece of the puzzle. It's not going to solve all of our problems around substance addiction, and we don't want to convey that answer because then people are going to, you know, not have the expectation of what, you know, in the end happens. So it's a small service. What we need is a menu of service options for people with addiction, a range of services that meets people where they're at in terms of their stage of recovery. And so the CTS is one of those pieces of a much larger puzzle. Definitely housing is important. The City of Windsor does have a progressive housing strategy and plans in place to do a hub model. So all of these things work in conjunction with each other to help provide the services to the vulnerable and the marginalized that they need.
Really appreciate both of your time tonight. Thank you.
Thank you very much.
Patrick Holowitz is with Hotel Dieu Grace, and Leslie Laframboise does outreach in the community. Now, this site, SafePoint, is temporary, and there's a committee now trying to find a permanent location. And some people, as you mentioned, like Leslie just mentioned, they think that it should live in a community hub, something like a homelessness hub. And spaces like that already exist in other cities, like in Toronto's Parkdale neighborhood. So we heard from somebody who runs that site. Here's what they had to say.
There are standalone SESs and OPSs in the city, and I think there are also benefits to them being standalone. It's more of like a community setting versus like a healthcare setting. I think the healthcare system can sometimes be off-putting, like I had mentioned earlier, due to like stigma, judgment, racism, just overall structural oppressive places for people who use drugs. Like, you can do this work in a standalone building. I think the difference is there is a larger wealth of knowledge when you're working with interdisciplinary teams, when you're doing care coordination, when you're doing referrals. The relationship piece is there. Once they build that trust with you, you can vouch with them. Like, you can go upstairs and sit in their appointment with them and help with advocating. And it's the relationships and the access. It's like a lot more accessible. It's easier for me to go upstairs and get a script for a client versus like if I needed to send someone to ER or send someone to like a walk-in clinic, it would be a lot harder for me to for staff to be there and assist in that process.
And this conversation is ultimately all about people and their health. So we want to tell you about another initiative in our community that's looking to get healthcare to those who might not have it.
There's a family doctor in Windsor who's looking to bring medical services directly to people who are living in shelter or on the streets. It's called a Shelter Health Initiative, and the doctor behind it is Jennifer Bondy. Right now, only some Windsor shelters have medical care on site, and that's through the work that Bondy has been doing. I was able to sit down with her as she saw patients and learn more about why she thinks this service is so important for Windsor.
Was there anything else you needed today?
Bondy is wrapping up an appointment with a patient at one of the walk-in clinics she runs. It's directly on site at the Welcome Center shelter for women and families. She spends a few hours each week here and at the Homelessness and Housing Help Hub. The health issues she treats are ones that can impact anyone, but often with this group, the issues can be more challenging and have likely gone untreated for some time.
What I'm dealing with is far more complex than what I have dealt with in the past in kind of a more average family medicine practice, because as I say, you often have an intermix of a physical issue, often with a mental health issue, and also we're dealing with a pretty major social issue in that oftentimes people are not housed, obviously. Oftentimes they don't have a reliable source of income. These are things that dramatically impact their ability to seek care and to continue to seek care.
Bondy's work looks to address a gap in service. A 2021 review of the city's Homelessness and Housing Help Hub found that it needed to expand its healthcare services. It based this off of the conditions it was seeing. It said many people had brain injuries and many people were using emergency services. The Downtown Mission agrees that its clients need more support.
You have definitely seen an increased need for more medical support and more medical help from professionals than what we are able to provide ourselves.
Right now, the Downtown Mission doesn't have any on-site medical care. The Windsor-Essex, Ontario Health Team, which ran a mobile medical clinic at the Mission, says some of its clients hadn't seen a doctor in 15 years.
It can be more difficult for this group to actually get to a doctor, as many don't have a physical OHIP card, Bondy tells me. She also says that there could be other barriers, like getting a ride to an appointment or even remembering that they have a doctor's visit. But she also says that many have lost trust with the healthcare system.
Dr. Ross LaPera is starting to build relationships at the Salvation Army. He's been doing this work under Bondy for the last 4 months.
When they're going to walk-in clinics or to the emergency department, they're seeing different people. They're never really establishing that relationship. Some of them may not have had great experiences in the past. So I think bringing it here, bringing these services, it's going to help establish that rapport, have familiar faces, and that makes you more willing to open up to talk about the things that you might not have wanted to talk about with someone else.
Bondy says that she applied for funding through the Ministry of Health about a year ago and hopes that if she gets it, she can expand this service to other shelters in the city. Jennifer LaGrassa, CBC News, Windsor.
CBC Windsor is here at Safe Point. Right after the break, Dahlia Ashley will have your weather forecast. Stay with us.
A chilly one in Windsor since yesterday, and that frost advisory is still in effect and will continue until tomorrow morning. So if you have any plants, make sure you keep them warm and cover them up so they don't die outside. We want to keep them protected. It is going to be dry midweek and some sunshine is on the way. So eventually you'll need to swap your umbrellas for your sunglasses. We're still sitting below the seasonal temperature. Usually it's close to 16 degrees, and today the daytime high is 7 degrees. So still quite chilly. That's why we're getting all that frost. But we're not going to have that for the afternoon tomorrow. It's mainly in the morning. Now, we still see that precipitation that's making its way tomorrow. And like I said, that frost advisory is in effect for Windsor, Leamington, and Chatham-Kent. Now, there is a little bit of that rain that's still below Windsor, and it's starting to fade away. But then as we head into Wednesday, so tomorrow, we're going to see a little bit of that cloud coverage, a little bit of sunshine, but it will be frosty in the morning. Now, as we head into the evening on Wednesday, still clear skies. We have the high pressure system, and that will carry through until Thursday, look at that, no clouds in sight. So we're going to say goodbye to that low pressure system, but it will be back later. Tonight, temperatures will drop to 1 degree in Windsor, and similar conditions across the board in southwestern Ontario. A mixture of rain and snow in London, so quite chilly there. And look at that, sunshine Wednesday and Thursday, but the weekend, though, looking quite damp. So make sure that you enjoy these next 2 days before we head into the weekend with those damp conditions.
Welcome back. CBC Windsor is live at SafePoint this evening. We're here, and I'm here with Jen LaGrassa. We're here because we're hours away from the doors opening to the community tomorrow morning. That's when it finally opens after 7 years. 7 years of push from health officials to make this happen. It's been a very contentious issue. The location has been up for debate over and over again, concerns about funding as well. Now, Jennifer LaGrassa has been covering this over the course of the last few years as well. Tell me what stands out for you in your coverage and your work.
Yeah, absolutely. I think it's the urgency of, when people come into this space and they want those treatment options. What I heard a lot of was, we can't wait for programming. Greg and Angus, who you met earlier, they talked about this idea that there's wait lists to get into places like Brentwood, to get into drug and addictions programming. And they said, when someone makes that decision to access treatment and supports, they really need that immediate care. They need someone by their side walking through with them day by day to get to recovery. And for them, it wasn't easy to get to that point, but they were happy to have programming that accepted them immediately. And could just kind of be there as they went through that initial withdrawal. So yeah, I think just having programming that doesn't have wait lists, funding those programs within the city.
Yeah, and Jen, I know, in my own personal experience, in my own work, I've had heartbreaking conversations with parents and friends of people who have lost people to drugs, to an opioid overdose. And I'm just wondering, from your conversations, is there somebody that stands out to you?
Yeah, I think Greg, who was in that piece earlier, really stood out to me in the sense that, he told me, he was like, I had a business, I had a family, I had a life, and it was really prescription drugs from, getting surgery where it just led down a slippery slope for him. And it was something that he never anticipated would happen in his life. And within 3 years, he kind of realized, I don't want to do this anymore. This isn't the life for me. And he's really changed things.
Thank you so much for this, Jen. Appreciate it for all your work tonight. Now, before we go, I do want to leave you all with some resources if you are in need of help. If you or someone you know is struggling with addiction, you can contact Community Crisis Services at Hotel Dieu. You can call 519-973-4435, and that number is available 24 hours a day. As for SafePoint itself, you can access services here from Monday to Sunday, 10 a.m. to 6 p.m. And I want to thank you all for joining us this evening. It's been a very important evening of conversations about the drug epidemic that has been really having a huge toll on our community, on this city, on a lot of people in our community. And we've been able to be in this space. The space opens tomorrow. SafePoint opens tomorrow morning to the community for the first time after a 7-year push to make it happen. Thank you for watching and have a good night.